Good morning again. Here we are with another episode with my dear friend Glenda from Chicago. Glenda, we are going to talk now. I want to ask you some things because I think I talked with you about this poster here. This is a soldier, and she's in the Air Force. This is Andrea. This is, you saw it in my house and you wanted me to show it. This is my girl. We could go ahead and put it down now. This is my girl, Andrea. Andrea is right here with the glasses on. She went to Afghanistan, and I met her on the plane. Mm-hmm. And you and I talked about it, our service people. You know, yes. What do we as Americans, knowing that these young people out there protecting our lives. I happened to be sitting on the plane next to this young lady, and I just started talking to her. I did not know that she really needed a mother figure. I did not know that. I just saw the pain and the sadness, and most of the sadness was she had just got married, and she was deployed the second time to Afghanistan. And I just reached over and grabbed her hand, and I just said, I want to pray. And I prayed with her, and I said to her, I will be your godmother. And I will be a pen pal for you. And lo and behold, she reached right in her purse and wrote down her address. Mm-hmm. She knew her address and gave it to me. And just tears was just there. As I get off the plane, I went straight home that day and wrote her a letter and sent her a copy of my books, of all of my books that I've written. And then we proceeded for 4 years to pen pal, write each other and talk to each other. And she actually did a YouTube about me. And now she's my goddaughter, and she has a son that's my grandson. And we were talking about that. I brought that up because I was so excited and just, I'm always in awe of you because you're just all over the place. And you started telling me about your affiliation or what you have brought from your heart to our servicemen, and I wanted you to tell the audience.
Yeah, I've always been military, and when I say that I mean someone has always came in my life or my world that was in the military and needed some kind of help, or like you said, sharing love. Can we do that? Do we recognize when somebody just needs a smooch, a hug, or a smile? Mm-hmm. Do we recognize that? And so I got very military veterans in 1995, 96 as well, because I came to the Hill with Dr. Philip Dajowski. Philip Dajowski was a doctor who they appropriated dollars to do research on military individuals with sarcoidosis. And they eventually, as he found all these cases, they did not want him putting the information out on the sarcoidosis. And I couldn't understand it, so they asked groups of sarcoidosis individuals. I had just got started doing advocacy for military and sarcoidosis itself. And I was asked to come to Washington with them to tell the stories of some men who were deck grinders in the military and was having issues. And they had been diagnosed with this sarcoidosis, yet the records was not being found, and they didn't want to be talked about or in regards to the sarcoidosis are taken care of. So I started campaigning with them, and I've never stopped. We have too many veterans that are homeless, so on the Hill they'll be talking about that this month in October 2015. I'm grateful because more and more, because of President Barack Obama is coming out to give more dollars to our militaries to help see about our military. And when I say militaries, I want to talk about the active part as well as the Vietnam eras and the other war area veterans, and definitely the family. I don't think enough is being done to give us the key, as I say, to the kingdom. And that key does this. It helped me be alert that if I'm having a medical issue and I am a veteran, I can go to VA. I can get service. And it's not always like that. I don't know if you know or not. The government do not advertise or send out letters or anything to the veterans or to the militaries. And like I say, we use both because military to me is the active ones that's going on now. Veterans are those who have served previous wars and times in life. And so I begin to look at the fact that if that veteran's hungry, hungry, I'm hungry. When that veteran is homeless, I'm homeless. What can we help better to do about them? Some of them want to talk and tell their story. Some do not. But the encouragement is you look at yourself, love yourself, and let us help you if we can. And I can't say how hard it is. I haven't been to a war to know that. Of course, my daughter was in a unit that was activated, but she was blessed. She didn't go because she was just getting ready to have a baby. Mm-hmm. So to say all of that is to say we must help our veterans. We must help the military. But as a family, the military and our government must help us. You know, that's right. Lost my husband previously, and 100% disabled, connected veteran. We need to talk about that because a lot of our veterans are on the street. They're homeless. They do have family. Some of them don't go to them because they're ashamed to Millie, because they have nothing they think to offer. Mm-hmm. But offer yourself and who you are so we can love that. Right. That's important. Right. Then we can walk the rest of the T90 steps to get to understanding how to get to them, to get you some help that you really should have, because you need. And, you know, let's make it more palatable for our veterans. That's all I'm saying to our government. It's a shame when you have the kind of numbers and counts of suicide or homeless vets on the streets and their family as well. That's not good. They have served our country. They deserve to be taken care of.
Yeah, that's true.
Yeah, because it just hurts my heart.
My father's still alive. He's 90 years old. And he was discharged disabled. And right now I've never seen the paperwork. You've really helped me since you've been visiting, talking to me about asking questions. See, we don't ask enough questions. We don't really do enough research to find out, because they don't really post it. They don't post it on the internet. They don't send you letters and tell you, right, okay, your daddy was buried in a manhole, and we saved him just in time, and then his appendix burst, and we had to send him home after we did a operation on his appendix, right, and he couldn't serve anymore, and so we sent him home, and we're going to give him this little pension. Well, we don't really know what he's really entitled to. Right. And you are being a great advocate for teaching women and young people who have families in the service of what they're entitled to. But that you just said the word, what are my entitlements, because that's what they call them. Mm-hmm. And yes, we need to know that. And if a vet is having any type of problem, whatever it is, especially if it's respiratory, your eyes and respiratory, eyes, and your skin, please, when you go to the veterans, ask them any test they do, look for sarcoidosis. That's not only with the Veterans Hospital, that's with any doctor. Remember I said, any doctor you go to, ask them to look for sarcoidosis, and whatever they do, they can find it in x-rays. They look at the blood work, and also if it's prevalence on the skin, of course, that can be biopsied and told if you have sarcoidosis. Mm-hmm. I just applaud them so, Millie, because I've been able to be out with some of the women's as well and see their plights and who's really fighting for them. Because like you said, if it don't come in the mail, or word of mouth is another thing we got to learn to use. When we hear things too out in the areas where we work a lot, or like me going on the Hill and to the legislators, I'm grateful that we have had legislations, some passed on sarcoidosis, but I'm fighting even harder now because military families need to be involved and taken care of as well. I don't want to go to a meeting with my husband because he has an issue and I got to sit outside and can't come in and see what's going on with it. I don't need him to be with a psychologist trying to help him but not helping me along with him. I'm sitting outside again and he walk him in there and talk to him and help him quit his job. Charles didn't have to quit that job. So it's so many things we don't know. Right. That's awesome, because I remember when my husband and I, we've been married now 25 years, first got married, I really didn't know that you could actually go into the room with your husband or your husband come into the room with you. Mm-hmm. And you're right. why not? So that we both can work together. Because if I don't hear what the doctor's saying,
Right.
he doesn't hear what the doctor's saying about me, how are we going to really go home? We're the one living together,
Right.
sleeping together, eating together. I need to know if he starts throwing up or if something starts happening to him, what is this?
Right.
And so I just, recently realized that, I could have my husband or even my sister or any friend.
Right.
Because
Any.
it's your right. And see, a lot of
It
people
is.
don't know that. It's
Right.
your right to say, I want her, I want this person that brought me to the doctor to come in. Because it's always good to have
Someone else
someone
with
else.
you.
Because you could get home and forget that the doctor told you not to take an aspirin before you get ready to go to surgery.
Mhm.
And the other person could say, oh, wait a minute. No, you can't take that.
That's true, because they're not going to write everything
They
down
don't,
for you.
and they
And
don't.
you do want to follow through with it and make sure, look, if I can't sit in this room, you better go get the administration of this demonstration here, because I'm fitting to sit in that room.
Mm-hmm.
I had to push my way into stuff. I had to let them know I was not anything to play with.
Mm-hmm.
That if you mess with me about my husband, because if something going on with him, could you imagine my cousin husband used to, she said they would have to jump out the bed and get on the floor because he was having visions of being in the war,
Oh, yeah.
and shooting. So could you imagine he go in there and the doctor's telling him one thing and you sitting out there and you don't know what's going on?
Yeah.
No, I need to hear that
Yeah.
conversation. I need to know what to be able to do, or how can I help him? We got children, they're young children, they're afraid of their own father because they don't understand what's going on.
Exactly.
So
Exactly. It's
we
a
have got to
family thing.
stop the veterans from not letting us come sit in on things with our family. It's a family affair.
It
It's
is.
gotta be.
Absolutely. It's gotta be.
I need to know. So when I have to go somewhere flying off to do legislation and he's with you or his sister, you need to know that no, he don't take this kind of stuff, but he do take medication and he does that. And he might get sleepy, like I told my mom. Charles ain't got up yet. I said, Mom, it's okay. It's the medication.
Right.
So it's things we need to know, family. And we need to talk about it when we are together. And it's not talking about it because we're talking about someone. It's talking about it so we can be knowledgeable,
Educating.
right, of what's going on, educated enough to make some informed decisions. And that's even for our younger children.
That's right. And it's inspiring and it's wonderful when you take a show like this and you're able to learn from somebody else. And then you can also go today. This technology is so wonderful.
It is.
But I mean, this is awesome for us to be sitting here just having a little chat on a TV show, the Miss Millie show, and just talking and educating even the younger people out there.
Yes.
And so this is going to be another episode coming up. We're going to talk one more time about something else. I'm so thankful that you came all the way from Chicago and allow me to just pick your brains and give all of your knowledge out there to my audience, because there's a lot of young women out there that's what we're supposed to do.
Yes.
We're supposed to teach the young,
Mentor.
the young, nurture. That's
Yes.
right, and that's what Glenda and I have always said, that's part of our passion. That's what we want to do. So we're going to close this episode with a laugh out loud for God, the Miss Millie Show, and we'll be back with another episode with Glenda, my dear friend from Chicago. I'm trying to get her here to Maryland. Laugh out loud for God. Thank you, Jesus. We'll see you soon.